Thank you for joining us on the Rhizome Center for Migrants Road to Return series. This is our second event with esteemed panelists discussing why we need to find a road to return back home for people who have been deported. On the panel today, we have mental health experts from across the Americas, affected community members who have seen the mental health impacts of deportation on themselves and their families. So we encourage you to share this on your Facebook pages, share this with your friends, and ask questions in the chat box and on Facebook. And hopefully we'll be able to go ahead and answer them on the live chat today. And if not, make sure you sign up for the registration on Facebook and on the Zoom link so that you can receive communications and invitations to our next events. So my name is Cesar Miguel Vega Magallon. I will be your moderator for this discussion. And very briefly, I'll hand the mic over to the Executive Director of the Rhizome Center for Migrants, Ms. Tran Dang, who will go ahead and share a little bit about this event and what we're trying to do.
Thank you. Hi, everyone. I'm Tran. I'm the director and the founder of the Rhizome Center for Migrants. We are broadcasting live today from Guadalajara, Jalisco, Mexico, where the Rhizome Center for Migrants operates. The world that can serve as a lifeline for those who have faced deportation. As part of our work to bring the deported loved ones home, we're convening a series of 5 live chats in which we delve deeper into the root causes of deportation and the longer consequences of repatriation in order to seek new solutions for our community. In our last live chat, we talked about the drug war, initially a war on immigrants that has targeted immigrants in the United States and fueled mass deportations over decades. In today's live chat on repatriation and mental health, we'll now look at the impact of detention and deportation on immigrants and their families. I'm very grateful to everyone who's listening in today. I know we have in the audience mental health practitioners, immigrant rights advocates, researchers, and educators, affected individuals, and local government officials. So welcome everyone. Our speakers today, Drs. Francisco Javier Salaquet Morales and Samantha, for lending us your expertise and your perspective in this discussion on repatriation and mental health. I also want to personally thank Nicole for having the courage to speak openly about your private experiences, which I know is not always easy to do. So thank you for being here and for contributing to this important conversation, which I'm actually very much looking forward to.
Thank you, Tran. And again, thank you so much to our speakers, Dr. Eduardo Morales of the National Latinx Psychological Association, Dr. Ramirez Barreto of the Mental Health Institute of the State of Jalisco, Dr. Carlos Salaquet of the Inter-American Society of Psychology, Samantha Silva, the director of Caminamos Juntos in Guanajuato, and Nicole Rayas, who is also a Caminamos Juntos as an affected community member. So one of the issues that we discuss a lot in the immigrant rights movement is mental health and its effects on migrants, and the way that we can expand access to mental health services, because as we know and as research has suggested, immigration is a life-changing event that is sometimes on par with events like divorce or the loss of a family member, and how it could impact children and people who go through migrations. So Samantha, you're working with de facto deported communities in San Miguel de Allende, Guanajuato. Could you tell us a little bit about this community? What happens to a family that causes them to be de facto deported, and what you're seeing at Caminamos Juntos in regards to their mental health and well-being?
Hola César, muchas gracias. Pues te cuento rapidísimo. Somos una organización que tiene 3 años ya en San Miguel de Allende. Trabajamos principalmente en el proceso de reintegración con mexicanos deportados y sus familias. Lo hacemos a través de diferentes programas como educación, terapias psicológicas, empleabilidad y nuestro programa de integración comunitaria para conectar a las familias con la comunidad. Y pues una cosa que hemos visto nosotros es que el proceso de de reintegración. Es un proceso multifacético, es un proceso que requiere un acompañamiento tal vez de largo plazo por parte no nada más de la comunidad, pero también con profesionales. Entonces, creemos que este panel es algo muy importante de empezar a poner en la mesa y tener este tipo de conversación.
Y Samantha, cuando una persona llega con su familiar a Guanajuato, por ejemplo, ¿en qué condiciones se encuentran emocionalmente, psicológicamente después de ser deportados?
Nosotros trabajamos con personas que llegan con sus familias, normalmente vienen ya, tienen familias aquí en Guanajuato. Entonces, desde la reintegración con la familia es un proceso que requiere el acompañamiento. El shock cultural, nuestro más de 15 años. Entonces, también existe un poco de shock cultural desconocido. Y en muchos casos no existe todavía una creación familiar. Hay veces que la familia se queda en Estados Unidos y desde ahí también vemos.
Sí, muchas gracias, Samantha. Nicole, you are someone who was forced to arrive in Mexico after your husband suffered a deportation for a cannabis charge, if I'm not incorrect. You had to make this. Sorry?
No,
Oh, my
no,
apologies.
no, it wasn't a cannabis charge. We were in the process of getting his citizenship and he was working and they caught him working.
So they caught him working. I understand now. You chose to keep your family together and follow your husband to a country where I'm assuming you knew very little about, maybe. And what was the experience like of preparing to follow your husband to a new country? And what did you feel like when you arrived there?
Well, at first we didn't really have time to process it. We went to court in April and they told us that day we had 4 months to leave. So they did let us come back voluntarily. You know, they didn't actually deport him and he didn't have to stay, you know, in jail or anything like that. So we were told in April, we sold our house, we sold our vehicles. The process getting ready to move down here at first was sort of exciting. It was something new. It's like, well, you know, we came to terms with it. We're ready, you know, and then as the day got closer, you know, I started having anxiety attacks. You know, I knew that this was the best thing for our family was to move with him because after 20 years together, you know, I couldn't let him face this alone. So we as a family decided to make the move. And when we got here, it was okay at first, you know, we were in a new place, it was pretty, you know, but after a few months, we realized, you know, we're here for good. And that's when we really started to feel, you know, the loneliness. He hadn't seen his family in years, so it was good that he got to see his family again, but for my boys, we tried to put them in school. They said there wasn't any room. We were like, what do you mean there's no room? And that's when I started getting depressed because of their education. I was like, what am I gonna, you know, how are we gonna fix this? And with the help of Caminamos Juntos, we tried a few bilingual schools and because my kids didn't speak Spanish. So they were already upset and heartbroken to leave, you know, their cousins and our family, and then to move here and not be able to speak the language, and then they couldn't go to school. So they felt pretty isolated, you know, I guess. And my husband, he never really said anything, you know, he tried to stay strong that way we wouldn't feel bad, but he just closed himself in also, like he didn't do anything but work here at, at our house. We got here, we didn't have running water. We didn't have bathrooms, that. So he just worked on getting that done. And I guess that's how he coped with the whole situation. But the hardest thing at first is we came here, we didn't have jobs. I didn't, have a way, I didn't even know where to look for a job. And then the kids' school, it was just a lot to take in at one time, the deportation, and then no school for the kids, no jobs. We had a little bit in savings, but after a few months, that started dwindling down, and then it was just.
It was hard, it sounds like, Nicole. And your boys, they were teenagers at the time, right?
Yes, they were.
Did you notice any changes in their personality? Did they seem like they were struggling to adapt beyond the language barriers? Did you see them withdraw, or what did you see as a mom? Were you concerned, for example?
Well, when we first got here, they were shy. I thought that it was just them being shy, but then they would go to their room. They slept in the same room, and they would go to their room. They would come out. Even when family was here, they would come out and they would get their food and go back in their room. Like, they didn't really even want to socialize with us. And then we started feeling like it was our fault, and then I even felt like if I hadn't married someone, that didn't, there was a lot of thoughts going through my mind that, if I wouldn't have married someone that didn't have their, the right paperwork, that maybe my kids wouldn't be suffering. But my husband is a very good person, so the paperwork, wasn't a part and why I married him. But then I felt, like my kids, like maybe they resented us for doing this to them. And they were really sad, and they never did say anything, but, after the fact, I overheard one of my sons telling his cousin that she wouldn't want to move here because she would just cry all the time. He cried every day the first month. And we didn't know that. So they tried to stay strong for us also. So it was heartbreaking after the fact because they didn't really tell us how they felt.
Thank you for sharing, Nicole. Dr. Carlos Salaquet from the Inter-American Society of Psychology has a question for you.
Uh-huh.
Thank you. Just as a clarification, Sociedad Interamericana de Psicología or International Psychological Society, SIP. Nicole, should I ask you in English or Spanish or both?
Either one is fine.
So I'm truly moved by the experience that you are sharing with us. It's a tremendous ordeal in a number of ways. And in working with some of my immigrant persons, I realized that if you come to the United States and you stay for a while, and then you have to go back, there is a process of acculturation both ways. In other words, you come here and it's a major, challenge. But going back is not that you are going to the same. Somehow you are not the person who left. Did you notice that in your husband?
Yes, and he's, he was born here. He left when he was almost 16, but he's more, I don't want to say American, like he's more accustomed to the American way of living. And even now, we've been here 3 years and he's still, I don't know, it's like, I don't see that he's fully acclimated to living here still. It's like it seems like he's still visiting, like he'll get to go back, he's just visiting, and it's like hasn't fully acclimated to living here again.
Thank you.
Thank you so much, Nicole. It's really moving to hear about your family's experiences, and anyone who has had a pleasure of hearing your story is truly moving. And I think we're all better off because you're willing to share and let people know what happens, and not just to the people who are deported, but their family members. And just my last question, Nicole, if there's one thing that you could have done differently on your road to coming to Mexico to follow your husband, what would it have been?
I think that I would have, I don't know how good you can actually prepare, you know, for somewhere that you've never been, you know, you've never experienced it before. But I think that in my, for anyone else, I would research, you know, where you're going, you know, because it was a surprise to come here and know that there weren't any schools available. You know, try to do a lot of research about where you're going, or, you know, the things in your area, because it was a big surprise, especially the education here compared to the US. And like now, I still homeschool my kids, you know, because of that. So I think anyone, because the economy here, you know, is way, way different than the US. So we left good paying jobs and to come here and not even make an hour, you know, a day what we made in an hour in the US. So it's, I still wouldn't change it. I would have still came, but I wish I would have known those types of things before I came, to maybe prepare, maybe save more money. You think, you know, oh, we'll be okay, you know, but financially, I wish I would have prepared a little bit better also.
Well, thank you so much, Nicole. I'm sure we'll have questions for you towards the end as well. Nuestro próximo participante en esta charla es el doctor Ramírez Barreto del Instituto Jalisciense de la Salud Mental, aquí en el estado de Jalisco. Doctor Ramírez Barreto, Jalisco ha sido un estado que históricamente ha mandado muchos migrantes a Estados Unidos. Y las familias jaliscienses, especialmente en lugares como Guadalajara y los municipios donde el mayor gente ha emigrado, también ven los efectos de la salud mental, en la salud mental, ¿no? La separación familiar. Incluso siendo uno de los estados donde muchos migrantes vienen después de la deportación. Ustedes en SAL me imagino que quizás han visto los efectos de la migración en la salud mental en poblaciones repatriadas, tanto como en migrantes en tránsito o personas que simplemente vienen a Guadalajara por ser una de las economías más importantes de Latinoamérica. Usted, doctor Ramírez Barreto, como director de SALME, ¿qué han visto y qué recursos existen para las familias como Nicole?
Claro que sí, César, muchas gracias. Digo, antes que nada, Nicole, muchísimas gracias por compartirnos tu experiencia. Creo que esto deja muy claro, como bien lo decía el doctor Carlos, lo que se vive cuando hay un cambio en la, cultural, ¿no? Y cómo esto genera mucha presión. Y sabemos, claro, desde la psiquiatría que este tipo de fenómenos, pues, generan un incremento en trastornos de la ansiedad, trastornos depresivos, trastornos del comportamiento de la conducta en los niños, ¿no? En los adolescentes, mayor incremento en el consumo de sustancias, etcétera. Sabemos que esto es un colorario muy importante para el tema de la salud mental. Y fíjate que en SALME, nosotros, el Instituto Jalisciense de Salud Mental, es en la parte de la Secretaría de Salud y el Gobierno del Estado, en donde es este instituto. Tenemos dos grandes hospitales, uno que se encuentra cerca del aeropuerto de Guadalajara y el otro en la zona de Zapopan, ¿sí? Donde tenemos divididas las atenciones en estancia prolongada, que así le llamamos al Hospital del Zapote. Ahí lo que vemos nosotros son trastornos graves, persistentes, como la esquizofrenia, los trastornos producto del uso de sustancias, etcétera. Mientras que acá en estancia breve en Zapopan, lo que más vemos es depresión, ansiedad, a la población infanto-juvenil y a la población adulta mayor. Y bueno, recalcar que parte de estos dos nosocomios son dentro de una red de integración donde tenemos módulos de atención en salud mental en prácticamente todas las regiones sanitarias del gobierno del estado, que son 13, ¿sí? Contamos con hoy por hoy a 9 centros de atención en salud mental y tenemos 14 módulos de atención en salud mental. Hay una pequeña diferencia cuando hablamos de un centro de atención en salud mental, porque son centros que, más allá de la atención, también llevan todos los procesos de rehabilitación y de reinserción comunitaria. En el hospital de estancia prolongada se tiene todo el centro de rehabilitación y de reinserción comunitaria, y aquí es donde tomamos a los pacientes que por alguna condición médica han tenido un deterioro importante de sus funciones y los llevamos de la mano hasta poderlos reinsertar en la comunidad. Claro que para esto, pues necesitamos mucho de la ayuda de la asociación civil, ¿no? De las universidades, y por eso tenemos un vínculo muy estrecho, incluso con otras dependencias, para poder llevar a cabo esta situación. Comentarles que, bueno, no solamente hacemos esta parte de atención, de brindar la atención, tanto por consulta externa como hospitalaria, sino también capacitamos a profesionales en salud mental en diversos tópicos. Hoy por hoy, con toda la contingencia, pues bueno, todas las capacitaciones en atención en salud mental derivadas de este fenómeno del COVID. Y por supuesto, mucho tiene que ver con el tema del fenómeno suicida y del consumo de sustancias, ¿no? Que trabajamos en conjunto con el Centro de Atención para la Prevención de Adicciones. De tal forma que lo que buscamos nosotros es garantizarle a la población en Jalisco un servicio de atención de calidad, ¿sí? En donde sean trabajados no solamente la parte médica, sino incluso la parte de personalidad a través de todo el trabajo psicoterapéutico, pero además social, con toda la parte de la reintegración social, con todo el equipo de trabajo social, familiar, porque a muchas personas hay que integrarlos de nuevo. Decía Nicole, de repente parece que su marido todavía no se integra, ¿no? Por supuesto. Y es que también tiene que haber una integración familiar, porque si tengo tantos años que yo ya no convivo con ellos, híjole, regresar, pues también implica esta integración. Entonces es un trabajo amplio que tenemos, ¿no? En los temas, por ejemplo, de las labores, ¿sí? En donde podemos buscarles un trabajo y donde ellos puedan, todas las habilidades que adquirieron en el extranjero, poder llevarlas a cabo. Tenemos convenios con empresas socialmente responsables que nos ayudan mucho en esta oportunidad de brindar trabajo. Y es decir, tratamos de integrar toda una red, ¿no? Ahora con la contingencia, desde el año pasado, el gobierno del estado sacó una estrategia que le llamamos inicialmente Quererte en Casa, que esta estrategia se volvía intersectorial, ¿sí? Que tenía dos rubros de atención. Primero, la atención per se a través de la línea telefónica, porque estábamos todos confinados en casa, entonces se refuerza la atención de la línea telefónica que hoy por hoy existe, que es el 075, pero además se refuerza todo lo que es promoción y prevención a la salud, ¿sí? En este fenómeno de la intervención telefónica se trabaja de manera intersectorial con otras dependencias del gobierno del estado para tratar de subsanar no solamente tu situación emocional, sino además la causa. Es decir, si estabas teniendo un problema emocional por suficiencia alimentaria, pues te canalizamos a la dependencia que se está haciendo cargo de ello. Y así, ¿no? Al tema del empleo, al tema escolar, etcétera. Es decir, siempre hemos tenido una visión muy integral que la salud mental, pues no basta solo darte el medicamento y mandarte a casa, ¿no? Sino tenemos que trabajar todavía aún más allá para poder lograr esta reinserción. Y en el tema de los migrantes, claro, somos un estado que comúnmente nos llegan repatriados, ¿sí? En donde se les brinda esta atención, en donde si su localidad de origen está fuera de zona metropolitana, se les busca el acceso a la atención de estos ISAMES o de estos centros de salud para que reciban no solamente la atención, sino también dentro de nuestros programas de rehabilitación, ya sea con DIF o con alguna otra dependencia que dentro de su localidad esté haciendo estos trabajos de reintegración.
Muchas gracias, doctor Ramírez Barreto. Y, por ejemplo, si yo tuviera un familiar, en el caso de Nicole, por ejemplo, que tiene una repatriación pendiente, que están haciendo las preparaciones y quieren ser proactivos en el cuidado de su salud mental, ¿qué es lo que deben de hacer al momento de llegar o ya cuando se están estableciendo para poder buscar el apoyo? ¿Y qué son los requisitos que una persona necesita, por ejemplo, para acercarse a SAME a buscar ese tipo de apoyos o servicios?
Claro. Podemos hacerlo desde antes, ¿no? Es decir, si una persona está preparando su repatriación, puede llamar al 075, esta línea, y pedir informes de cuál es el centro de salud que queda más cerca a su comunidad, ¿sí? Para que pueda recibirle la atención en su comunidad. Realmente lo único que necesitamos es que acudas a atención. Nosotros brindamos una atención gratuita cuando es una consulta externa y todos nuestros procesos de rehabilitación son de manera gratuita, independientemente de tu estado migratorio además. O sea, recuerden que la salud en México es universal, hoy por hoy ya gratuita. Entonces, para nosotros es solo que acudas a atención, ¿sí? Sí te pediremos algunos datos más de índole estadístico o para temas estadísticos que para brindarte la atención. O sea, no negaremos la atención.
Muchas gracias, Dr. Ramírez Barreto. Dr. Carlos Piz-Alacat, quick question. The Inter-American Society of Psychology is an international organization. You have membership across the Americas. We know that migration is a transnational issue, that migrants in one place tend to move quite a bit, that issues of mental health can be severely impacted as people cross multiple borders. In the case of Nicole's family, it wasn't just the migrant person that was affected, but also their citizen family members who might have otherwise never had reason to migrate or to have been affected by this. In your opinion, Dr. Zalaket, as a mental health care professional, as someone who works at a transnational psychological association with membership around the world, what do you see as a need for governments to collaborate on, or what can be done better to ensure that migrants receive the adequate mental health care, or that we prevent the need to, we can prevent traumatic events like what happened to Nicole's children and Nicole?
No, that is a loaded question. It's a question that requires a complex, multi-system, multi-layer response. But you are right. That's what we need. In other words, when you think about immigration and deportation, it works around the world. What used to be known as a phenomenon in certain parts of the world today is an international phenomenon. For example, one of the experts in immigration into Chile, because I'm Chilean by birth, and then Texan by rebirth, and now Pennsylvanian by choice. But the point is, the immigration into the northern part of Chile from countries like Peru, Haiti, Venezuela, is extremely large. Okay? And in that way, there is no only an internal solution, a single country solution. By now, we need to look, for example, Nicole's situation is extremely different than many other immigrant and deported families. Okay? What we see through the Society of Inter-American Psychology, la Sociedad Interamericana de Psicología, es que hay muchos psicólogas y psicólogos profesionales de la psicología trabajando con diferentes grupos. Ya mencionaba a Alfonso Ursúa, que el doctor Ursúa, que es el presidente entrante, él tiene toda una serie de estudios en el norte de Chile. Pero hay muchos centros en Argentina, en Centroamérica, Guatemala, El Salvador, etc. Interesantemente, aunque es un tema tan central y del cual sabemos mucho, hay muy poca coordinación gubernamental. Déjeme, por ejemplo, mencionar, cuando miro su agrupación, ¿no es cierto? Yo no sé cómo pronuncia, Rhizome Center. Okay. And so, you know, I'm a Longhorn, so if I were SHSU, where I went to work, I would have been visiting you day in, day out, because you do a fantastic job. Not only you think about the immigrants in an international platform, but also when you look at, for example, Mexican immigrants deported, you thought about something that is brilliant, which is how do we connect with agencies in Mexico, for example, so they can provide the help for those who are sent back. Nicole, let me ask you a question. I know you didn't have enough time to process. You guys packed and went. But the question is this one. Was in the first line of attention to think about seeking help?
Not
Psychological help?
not at first, because I really thought that we were going to be okay. You know, I came to visit, that we had started building our house, you know, we'll be okay. But then after like 2 or 3 months, I started to realize, you know, this is a lot harder than what we thought. You know, he hadn't seen his family in, you know, 20 years. His 8-year-old sister was, you know, 30 now, you know, nothing was the same. You know, even his family, it's like they were his immediate family, but they were new to him. You know, like it was like meeting someone new. So like, it was strange. I don't know of another word, you know, it's like I don't know, it was a strange feeling especially for him, seeing his brothers and sisters when they were little kids, and then now they're grown with kids. So it was.
Yeah. I honor your experience. I asked you for your husband, but truly don't think I didn't think about you all going through this experience. It's a tremendous challenge. And a number of times, you know, we don't pay enough attention. And that's the reason why the systemic approach with governmental support, Dr. Ramirez Barreto, he was telling us, well, we have universal health, and they are developing a system open with no questions asked about immigration status. That should be a standard in many places when it comes down to mental health. Second, the idea of preparation, of prevention, preventative programs. What Nicole went through, you know, we would have expected some of that. And we could have offered them as opposite to wait for them to ask. So there is a governmental-led humanitarian effort that should be in action. And that will be my first request. And you all sent a letter to President Biden asking for acting. We should send letters to all our presidents and ask for acting. Now, on behalf of everybody, the COVID created a major challenge and really upset the whole situation. We had a major effort. The intent was to try to coordinate many of these professionals, professional psychologists, to come together and form a network. And that's very important because when you think about people who are deported, you know, they are not always unhappy. And let me clarify that. Depending on the number of years you are in the United States, if you don't have a strong family connection, if you don't have a network, if you don't have a potential job, if you experience microaggressions and all the racist attacks, you know, to immigrants and immigration, if you have flickering policies, it gets to a point where it gets to you. So stress, depression, you know, and of course, anxiety become very highly strong. So going back, the assumption is that at least you are going back to a known place, only to realize that it's not the place that you remember. Do I have a last second? I was born with John Wayne, just to show you how cultural factors can take place. With John Wayne defending the Alamo. I went to see the Alamo because I really want to see it. And two things I found. Number one, I couldn't find it. By the fourth time that I drove in front of him, I asked a police officer who said, "That's the Alamo." And he pointed to the other side of his car. I was right beside the Alamo. And it didn't have the size that I dreamed since I was a kid. The second thing that I learned, just to show you how an immigrant can be so ignorant about history, is that I came in and the first thing that I saw was the number of Mexicans who died defending the Alamo. Did you hear that? When I asked in my conference, how many Mexicans died defending the Alamo? What do you think everybody says? None. And you go, no. It's much more complicated, sociopolitical and emotional and psychological. So the reality is that we are much more brothers and sisters and relatives that we will ever give us a chance. And we need to bank on that. Remember, race, doesn't exist. Look at the heritage, and it doesn't exist. So we have to change that. We have to reduce even biases in terms of, for example, seeking help. But you have to find people like Dr. Ramirez Barreto explained that are trained to provide that help. Not every professional knows how to support a deported person. Yeah, and let me stop there. Thank you for your patience.
Thank you so much, Dr. Zalaquet. I think you teed us up perfectly for the next question to Dr. Morales. Dr. Morales, there were studies around the time of the 2016 elections about the anti-immigrant rhetoric and its effects, for example, on school children attending public school in the United States, about increases in bullying. And this was sort of, at least from my perspective, after about 8 years working in immigrant rights at the time, it was sort of a culmination of a very long history of marginalization, of microaggressions, like Dr. Zalaquet mentioned, and of a general stigma around mental health issues in the wider Latinx community, but also specifically among Latinx migrants. At the National Latinx Psychological Association, one of the things that I've seen done is the advocacy for mental health access and mental health treatment, and people to seek it and break certain barriers and stigmas. What are you seeing now, Dr. Morales, in terms of the state of migrant mental health in the United States, particularly in the context of recent figures that showed that even though deportations have slowed down, they're still continuing?
I think people have this image that immigration has to deal with just agencies, and I don't kind of view it that way. It's really the whole nation that has to embrace the newcomer coming in. I sponsored 3 people, for example, and I thought, well, okay, I'll give them a place to stay and I'll show them where the, show them around. No, I had to hand by hand take them to the store, show them the products, and actually tutor them as to what the actual day-to-day process is in terms of living here on a practical level. So when it comes to immigration, it isn't just one agency with another agency and then the laws in between. Also, there's this kind of concept that, to come into the United States, there's one line. There isn't one line. There are different lines to come into the United States legally and to get a visa. You can come here as a tourist or a visitor or a student or a business person. If you have money to invest in a business, I think it's $750,000 to $1 million. You're going to invest in a business, then they'll give you a visa for that. Political asylum, or you're joining family, your family's in the United States, or you're just seeking to live there. So those are different processes that immigration has to deal with in terms of who they process and how they're processed coming in. But somebody has to be at the other end to take the person by the hand and say, okay, I am going to tutor you. I'm going to be your day-to-day mentor, and I'm going to show you where the milk is, where's the butter, where's the toothpaste and dental floss, and simple things like that. Where's the supermarket, and how's the money change, and how does it work, and things like that. And that really takes the citizens by being a sponsor to do that. So a lot of what we see here are people who are in a situation of limbo of political asylum, they can't work, but they're waiting for the court decision to happen, and the court is being delayed. The COVID situation has not really been helpful in moving the thing forward very quickly. Then you have to prove if you're here for political asylum. So the first thing, I'm also an executive director of a nonprofit here. So the first thing we do with our clients is we link them up with an attorney, because this is just too complex to deal with the myriad of systems that you have to deal with when it has to deal with the immigration law. And then we can also provide the emotional support as an agency as they're going through the process, and make sure that they have a friendship circle that can help them on the day-to-day level going forward, so that they can deal with the day-to-day practical situation. With apparently Nicole didn't have that. She kind of thought, oh, okay, I'll just get on a plane, go down there, and then somehow people will show me where the basic things are, and I'll be able to navigate. And actually, you know, you get confronted with different customs of how to shop, different customs of how to relate to each other, and different customs of how you interact with each other that you don't expect or you don't have when you're here. And so somebody has to teach you that and show you that. And then if you do feel like you're experiencing the microaggressions, who do you talk to? You know, having one session a week or every other week is really not going to be enough. You know, so what we can do is link you up to certain resources that can collectively help you, but then we have to like manage all of those sources or agencies that don't tend to talk to each other, to try to talk to each other, so that your process moves forward in a smooth fashion, so we can take care of the practical aspect of you being here legally. But then there's the emotional part of you having the proper social networks and feeling like this is a home for you, and learning the language properly, and then learning the customs properly. So these are the different kinds of things that we find ourselves dealing with when we're dealing with people who are coming into the United States. The anxiety about their status is so uncertain. And then if they have to go back, or they want to go back because they long for seeing their family that they hadn't seen for a while, well, when you're in the middle of the process of your case being reviewed, you cannot go back, especially if you're in political asylum. So, I mean, you can call them, you know, maybe if they have access to Zoom or, you know, Skype or something, you can talk to them, but you really can't go and visit them, because that will unsettle your case and dismantle your case legally. And so they'll throw your case out of court, and then they'll throw you back to your country. So this process also happens in terms of what was mentioned about even among Puerto Ricans. You have a whole group of Puerto Ricans that have moved to the mainland, lived here for many years, decades, and then moved back to Puerto Rico, and they're thinking of Puerto Rico as it was when they left. And when they go back, they realize, well, wait a minute, this country is now very, very different than what I remember it. And then trying to figure out, oh, what are the new customs and what are the new ways of how to deal with the culture that I was previously thought it was, and now is actually changed. So those are the kinds of things that we kind of struggle with here in terms of being a provider, and also as an association trying to create the knowledge base among new trainees and service providers, so that they can actually understand the complexity of this kind of thing that goes on when somebody comes to the United States, is in a state of limbo, and then suddenly, if they successfully stay here, you still have to do a lot of hand-holding. If they have to go back, then you have to deal with the process of repatronizing them, and then making sure that they have the proper linkages when they do go back, to try to deal with going back and the process that involves.
Thank you so much, Dr. Morales. I think you very clearly laid out and how intertwined the legal issues are, as well as the mental health issues, and that resolving one without resolving the other, for some people, isn't a possibility. You as a professional, have you ever been involved in advocacy along immigrant rights issues, or do you see a possibility of, for example, turning mental health practitioners and advocates in mental health into migrant champions and vice versa?
Yeah, absolutely. That's part of what I do in my training I'm a professor of psychology as well. And so I train my students about, well, your role isn't just doing mental health and doing the diagnosis, but also you have to be an advocate for the client or the patient in terms of the other systemic issues that they're facing. And you have to be resourceful in terms of how they navigate those systemic issues as they go through their lives. So, just thinking of things in terms of, mental health services in a very, very traditional way, you're just not going to be very successful unless you incorporate a broader vision of what this person is experiencing and looking at their life in a much broader way and incorporating that in how you provide the services to the person.
Thank
So
you so much,
that's
Dr. Morales.
becomes very, very important. Yes.
Thank you so much. I think you're absolutely right. It is difficult to have that more holistic view, but I think for our community, it's essential. Tran, Ms. Deng, one of the things the Rhizome Center did was circulate an open letter that had proposals that would, for example, address some of those systemic issues for people who are currently abroad and who have found themselves deported over the last 3 or 4 administrations. This letter included the ability for deported people to return to the U.S., which would give, for example, Nicole and her teenage boys the opportunity to reestablish ties that they were forced to sever when they wanted to keep their family together. Could you tell us a bit about these proposals, how they came about, and why they are important in terms of solving the mental health issues of deported people here in Mexico?
Sure. One of the priorities of our organization is to seek policy solutions to improve the lives of people like Nicole and others whose families have been disrupted and destroyed by deportation. I first just want to say that it's a source of shame for the United States that the kind of long-term psychological challenges and damage we've talked about today is sanctioned by our current immigration system. Millions of people have been failed by the refusal of our immigration courts to presume extreme hardship for families who are facing deportation. And as a result of that, we now have a situation where spouses, parents, and children of US citizens have been separated from their families. Millions more still face the possibility of detention and deportation. And we now have here in Mexico over 1 million displaced US citizens like Nicole and her sons who are living in Mexico under difficult and traumatizing situations, not knowing if they can ever return to the United States. This type of situation does have generational impacts for families like Nicole's, as well as immediate and severe emotional financial consequences for the family. We, as a country, don't have to accept this. We don't have to force people and communities to endure this kind of ongoing psychological nightmare. We can change our immigration laws to remove the barriers that prevent families like Nicole's from returning to the United States as a family. So when President Biden took office, on the very first day, he announced his immigration plan, which included making family unity a sort of cornerstone of that plan. And we responded with an open letter to President Biden with proposals on what he might do to achieve true family unity, which includes uniting families that have already been deported have already been separated by deportation. One of the proposals that we make that would also help Nicole and her family is to remove the 3 and 10 year time bars. So these are in place as a punishment for people who have lived undocumented in the United States for any significant period of time. if we remove the 3 and 10-year bars, Marcos could apply for a visa to return to the United States immediately, and the family can return together rather than have to wait more time in Mexico. The United States should remove the extreme hardship requirement as a condition for seeking waivers to return home. If a waiver process, or perdón, as it's referred to here in Mexico, is provided by law, Marcos should not be required to show that his family would suffer extreme hardship if he were denied entry. Believe it or not, this is actually quite difficult for families to show extreme hardship, even though for a layperson, it's quite clear that families suffering from deportation or displacement are experiencing trauma, hardship, in many cases, profound loss. So based on the conversations that we've had today, extreme hardship should be presumed as a matter of law and should not be a disqualifying factor in any application for return where the applicant has qualifying relatives in the United States. There are also other grounds of inadmissibility for which there isn't a waiver process, meaning there's not a way to return. These automatic bars exist, for example, for people who have an entry without inspection after prior removal, multiple deportations, or who have made false claims and misrepresentations. In the interest of family unity and mental health, the United States should provide a waiver process in these cases so that these families can unite. Finally, after return or deportations, it's extremely hard for people to be able to return to the United States for even a day. For people who merely wish to visit the United States, President Biden should create U.S. Embassy and consulate directives that require officers to consider temporary family reunification of returned and deported individuals as a positive discretionary factor at the time of issuing non-immigrant visas. If these proposals were adopted, Nicole and Marcos would be able to return, and their children would be able to grow up in the United States with their grandparents, their aunts, their uncles, their cousins, and we can end the emotional toll that living outside of the United States has had on them by providing with a viable road to return. So in our open letter, we asked President Biden and Congress to ensure family unity by removing all barriers to return so that these families can be and thrive where they were meant to be. And I'll include it in the chat, but are still available on our website. And I would encourage all of you to read it and support it.
Thank you so much, Tran. I think we've seen today, right? And I think Dr. Morales put it very succinctly, that we need to address the systemic issues affecting the psychological health of our communities if they're going to be well. And we've seen throughout the immigrant rights movement that sometimes our mental health efforts don't see legislation follow, and we don't see that those solutions are offered to our community. So thank you so much for sharing these proposals, and we'll definitely be sharing the link on our Facebook page if anyone would like to go ahead and read the proposals, the open letter, and see all of the 70 plus signatories around the world who believe in the right to return. We do have a couple of audience questions, and I would like to use the last 7 minutes to address them. Doctor Ramírez Barreto, quizás estas preguntas son para usted. Tenemos una pregunta de parte de alguien de la comunidad deportada aquí en México acerca del tratamiento que han recibido o otras personas que han acudido a tratamiento psicológico o psiquiátrico dentro de México, que no se sienten bien atendidos o que no sienten que los terapeutas tienen la capacitación adecuada o específica para ayudar a personas repatriadas. También en Facebook nos hicieron una pregunta acerca de qué se está haciendo o qué ha visto usted o qué se podrá hacer, no sé, para apoyar a los profesionistas de salud mental a dar los servicios adecuados a la comunidad repatriada.
Claro. Evidentemente, digo, es un fenómeno que sobre todo en la salud mental juega un papel importantísimo la cultura, ¿sí? Y para ello, claro que existe una barrera cuando las dos personas son de culturas diferentes. Sin embargo, hoy por hoy existe toda una currícula de entrenamiento que se llama psiquiatría transcultural, donde se nos está entrenando o estamos entrenando a todos nuestros profesionales en salud mental. Porque bueno, esto no solamente es de las personas que viven en otros países, sino dentro de nuestras propias regiones. Tenemos personas que distan mucho la parte cultural y que también de alguna manera venirse de una comunidad, sobre todo de población indígena a la ciudad, pues también les genera el mismo choque y se puede decir que también son personas repatriadas y refugiadas. Entonces, de alguna manera, esta psiquiatría transcultural ha sido la respuesta desde la asociación, desde las asociaciones internacionales en salud mental para poder capacitar a todos los profesionales en salud. En Salme, dentro del entrenamiento que reciben nuestros residentes, ya tienen esta currícula de psiquiatría transcultural.
Muchas gracias, doctor Ramírez Barreto. ¿Algún otro panelista, doctor Morales, doctor Salaquet, que quizás tengan algo que ofrecer acerca del entrenamiento, por ejemplo, o la capacitación para profesionistas dentro del tema de salud mental?
Mi querido doctor Morales.
Bueno, es que los cursos que tenemos en los Estados Unidos no ven muchas veces no ven las cosas en una manera multicultural. Muchas veces ellos ven una cosa en una manera y no ves que, bueno, si alguien viene de otra cultura, cómo las cosas se pueden cambiar o ser muy distintas. Y en eso el entrenamiento que tenemos en los Estados Unidos, hasta una cosa sencilla como darle el servicio en la lengua preferido a la persona. Tú sabes, en todos los Estados Unidos hay menos de 10 universidades que da entrenamiento en español para dar terapia. Imagínate. Y aquí en California, donde tenemos que 38, casi 40% de las personas en California son latinos, identifican así, vamos a decir 40% de ellos prefieren hablar en español. Bueno, si no hay un lugar en California donde los que están entrenándose a dar estos servicios los pueden tenerlo en español, bueno, ¿cómo podemos tener la capacidad en las agencias que tenemos para dar los servicios en la lengua apropiada o la lengua preferida que el cliente necesita? Yo como doctor y también director ejecutivo de Águilas, donde tenemos la capacidad de dar servicios en 3 idiomas, español, inglés y también portugués. Muchas veces nos olvidamos de nuestros hermanos de Brasil, pero aquí tenemos muchos que son de Brasil, por ejemplo, y están a todo alrededor de la bahía y a ofrecer. Nosotros somos la única agencia en la parte norte de California que da servicios en los 3 idiomas. Todos los servicios, no solamente que tenemos una persona que puede hablar un idioma y otra persona que puede hablar otro idioma, pero todos los servicios se encuentran en los 3 idiomas, no importa. Y eso es lo que nos falta aquí. El sistema está muy fracturado en ese sentido.
Thank you so much, Dr. Morales. In the interest of time, I really want to thank again all of our attendees, all our panelists. Nicole, I actually want to give you the last word today, if that's okay. Very brief question. Immigration reform is being discussed in the United States. We see a lot of movement around various different laws, various different proposals. If you were able to return with your children and your husband to the US today, what difference would that make for you, or how would you feel?
It would be good to have the choice back. Like right now, I can, I can go back, and my kids, we're citizens, we could go back. But I couldn't see leaving their father here to deal with this on his own. So it's like, it would feel good to be free again, to have that choice to be able to come and go as we want. Because when my husband was in the US, he couldn't come back to Mexico. So now that he's back in Mexico, he can't go back to the US. So we can go, but he's not part of the equation. And that's, he belongs there with us, and we just want the choice back. Because we may decide to live here, but at least we would have the choice.
Thank you so much, Nicole. And we hear that a lot, right? That it's about choice and the ability to move. That's sometimes the most difficult part of not being able to move across borders. It is the top of the hour. I want to thank all of our panelists. I think this was an incredible discussion regarding mental health and migration. I think we heard a very moving testimony from Nicole and her family, from Samantha Caminamos Juntos, one of the only organizations that offer support for de facto deported family members. We heard three incredible mental health experts, Dr. Morales, Dr. Salaquet, and Dr. Ramirez Barreto, working across borders, offering services and advocacy on this issue. And we also heard something very important, right, which is the need to include the deported in immigration reform efforts, and to make sure that we are talking across professions, across advocacy fields. Because as Dr. Morales, again, very succinctly put it, we need to address the systemic issues affecting people who are undergoing mental health stressors. So my name is Cesar Miguel Vega Magallon. I was the moderator today. This is the Rhizome Center for Migrants, Road to Return live chat series. Thank you all who attended, and this video will be available on Facebook after the event if you would like to watch it, and make sure to go ahead and tune in for our next live chat. All right, guys, have a good day.